you can read here.
Okay. FDPLTCP0.
Okay.
All
right, and try the other one.
FDPLTCE0.
Okay, and now with both eyes.
FDPLTCEO.
Okay, and can you read the line above the green line?
EDFCZP.
Excellent. Okay, let's go back over here and weigh you. Okay, is that about normal for you? Alrighty, good. And just stand to your, move your back here. Put your feet together. There you go. Okay, let's take a look here. Here on the end. And I always like to start with the ears, so we're just going to start with those ears. Here, thank you. Right. I'm just going to look kind of here behind your ears. Okay, any discomfort there?
Nope.
Okay. Let's take a look. Okay. I want you to whisper what I whisper, okay?
PA school.
And let's look in this other ear. Okay. Take a look in here. And now I'm going to whisper one more thing.
Red Sox.
Okay, your hearing is good. If there was any doubt at all about how your hearing was, we'd do some additional testing.
Okay. Yeah.
But I don't think that there's any problem there. I just want to look at your hair and your scalp. Okay. Any tenderness or discomfort there?
No.
Okay. How about back in here? You tender at all around your neck? Okay. And I don't feel any glands back there. And I'm looking to see how symmetrical your face is there. And let me just get your glands while I'm here. Right. And give me a swallow. Excellent. Alrighty. And I want to shine a light on your eyes. If you look right straight at my nose. And look right straight at my nose again. Okay, good. And I want to have you follow my finger. Just with your eyes. Okay. Follow. Follow. There you go. All the way out here. It's nice and easy to see your pupils. Hey, you got any tenderness over your sinuses?
No.
No. I bet you don't see it. Okay. And while I'm here, just put your jaw up and down for me. Okay. Wiggle it back and forth. Okay. Raise your eyebrows. Frown at me. Smile. Show your teeth. Okay, that's good. And now I want you to look straight into my eyes, and I'm going to ask you to add up how many fingers I'm holding up.
4.
Okay. So that looks fine. And if I had any concerns about your vision, I would go ahead and do a near vision also. But you did a nice job on that other chart, so I'm not worried about that too much. Okay, now I want you to look way off in the distance there while I check your eyes. Okay. Right, that looks good. And let's take a look here. Nice optic. Nice macula. I can see the veins pulsating in the backs of your eyes. That's good. We like that. And let's take a look in your up your nose first. Oh, see, here's sniffing. Okay, one sniff. Okay, and we're gonna just take a look up your nose. And if I had any doubt whatsoever about your smell, I would actually test that, but I'm not worrying about that right now. And open real big. Okay, say ah. Okay, good. Okay, put the tongue up on your roof of your mouth. Okay. Hey, good. I'm gonna just put my gloves on here, and I want to just palpate inside your mouth, make sure that everything feels fine. Okay. Alrighty, I'm just gonna check around the outsides here. Your teeth. When was the last time you went to the dentist?
Like 6 months ago.
Yeah, they look like they're in good shape. Okay, I'm just going to feel on the floor of your mouth there. And now I'm going to feel up here. Okay, and just up across the top. Alrighty. Okay, and last thing with this, just push in there and push there. Okay. Now, if you would please tip your head as far back as you can make it go. Okay, good. And now tip forward. Okay, and you can put it up again. Now take your ear and put it on your shoulder. And take your ear and put it on your shoulder. Good. Okay. Give me a push here against my hand. Okay. And again. And again. Okay. Okay. And push my shoulders up. Okay. Excellent. Alrighty. Now, I want to look at your shoulders. And let's see, I've forgotten what sport you do.
Volleyball.
Volleyball, that's right. You guys had a good game the other night.
Yes, we did.
Okay. And are you tender in any of your joints?
Nope.
No? Okay, good. Now I'd like for you to take your shoulders and push up as high as you can go. All right. And now push back. Go back as far as you can go. Okay. And take your hands like this. Okay. And take your hands like that. Okay. Now go like that. Okay. And now go up sideways. Alrighty, good. And I would like you to push against me now. And pull in. And push forward. And push back. Okay, let's do the same on this side. Okay. And in. Okay, good. And up. And down. Okay, let's keep your hand up. Okay, down. Okay, good. Now try to twist it. Okay. And try to twist it again. Okay. And up and down. Okay, try to twist. Okay, good. That's good. And let me see you. Okay, good. Excellent. Alrighty. Now, if you would take your fists and up and down. Okay. Now towards the middle. Right? Can you twist it right there? Okay.
Oh, like that?
Yeah,
Okay.
right there
Yep.
you go. And now towards the outside. Okay, good. Alrighty. Now do it against my hand. Okay, up, down, down, that way, that way, that way, that way. Okay, squeeze my fingers. Alrighty. Take my fingers. Now don't let me pull you apart. Alright. And while we're doing things with hands, how about taking your hands and going like that, back as fast as you can. All right, okay. And take this finger, touch it to your nose, okay, and touch my finger. And now again, as fast as you can, and again, as fast as you can. Okay, now take the other one. There you go. There you go. Okay, that's good. All righty. And now I'm going to just do a couple of sensation things here. And I'd like you to close your eyes and tell me, does that feel the same as that?
Yes.
Okay. How about that and that?
Yes.
How about that and that?
Yes.
Okay. And just put your hands out like this. And how about that and that?
Yes.
Okay. How about that and that?
Yes.
Okay. Good. Now I have a little. Oh, yeah, the little. There it is. Okay.
Sorry.
Okay. Alrighty. Now this is going to be sharp. Okay. So tell me, do you feel the difference between that and that?
Yes.
Okay. So that's sharp.
Yep.
That's dull.
Okay.
Right. Tell me whether you feel sharp or dull.
sharp, sharp, dull, sharp, sharp, sharp,
Okay, now let's do the same thing down here.
sharp, sharp, dull, dull, sharp, sharp, dull.
Okay, good. Now, just for the fun of it, we're going to do one more test here. And this involves vibration and pressure, okay?
Okay.
So the first thing I'm going to do is I'm going to press this here. Now, that's vibration.
Okay.
Can you feel that?
Yes.
And now feel the difference when it's pressure.
Yes.
Okay, let's try it.
Okay. Vibration,
Okay?
vibration, pressure, vibration, vibration, pressure.
Good. So I think your sensory apparatus is intact here, but we're going to do one more little set of things for the fun of it.
Okay.
Okay?
Mhm.
So hold your hand out.
Mhm.
All right, now I'm going to put something in it, and you tell me what it is without looking at it.
Paper clip.
Okay? And now the other hand.
A key. Oh,
Okay.
sorry.
That's all right. I didn't give you very clear instructions,
A
did
key.
I? Okay, let's try this again.
Okay. Penny.
Okay, excellent. All right. Well, that all looks very nice here. So let's take a look at your back. And the first thing I want to do is I'm just going to look at you, okay? And I want to look at your skin, particularly since you are so lovely and blonde and blue-eyed. Make sure there's no skin lesions there. And I already looked at the skin on your arms. And now, would you please take a nice big breath in, okay, and let it out. Excellent. Okay. And I'm just going to tap on you a little bit. Pull this up.
Mm-hmm.
Okay, good. Okay, that all sounds fine. And since you're not having any symptoms, I'm not going to do any fancy testing there. All right, and then if you would just please take a nice breath in and out through your mouth. Okay. You getting lightheaded?
No.
Okay, good. All right, let's try in here. Okay. And in here. And one more. And, whoops, sorry, one more. Okay, good. That all seems to be fine. Any discomfort in the kidneys? No. Just tip your head that way a little bit. Okay. Alrighty, and that looks absolutely fine. I'm just going to check your carotid pulses. Okay, I'm going to give a listen down here. Okay, good. And now let's just pull this down a little bit so I can look right at your chest here, your chest wall. Okay, and I'm also looking at your skin. And have you got any chest tenderness or anything like that? No. I'm going to just feel over the different areas where the heart valves are. Okay. And in here. Okay. Okay, excellent. Now we're just going to take a listen. And I'm going to be listening. I'm a slow listener, so be patient with me, okay?
Okay.
All right. I like to listen to heart sounds very carefully. everything sounds just fine, but I'd like you just for a minute to roll up here on your left side and let me listen to your mitral valve a little more closely. Good. Sounds just fine.
Okay.
And now I want to do the same thing we did to your lungs before.
Mm-hmm.
Just going to tap on you a little bit. Breathe in again, just nice deep breaths. I'm sorry. Okay, let me switch over to my iPhone. Now I'm just going to pull this up so I can look at your belly. And pull this down so we can look at your belly. And it all looks just fine. Lift your head up for me. Just pull your whole head and shoulders forward. Okay, good. Now I'm just going to listen to you. And I'm just going to pull down here and listen over your femorals. And in here and listen over your femorals. Okay. Sounds good. Now, I want to check your carotid against your femoral. Sorry, that's way down there.
That's okay.
And while I've got access to both your hands, I'm going to just check all these other pulses too. Okay. I'm just going to tap on you a little bit. Okay. And just help it a little bit. Feel any bladder problems?
No?
Good. Now I'm just going to mush on you and feel your aorta here. Okay, alrighty. And since everything seems to be just fine, I'm not going to bother to check your liver or your spleen because you don't have any symptoms that would suggest that we need to do that.
Okay.
Okay, and then let's let me see you lift this up to your. Okay, good. How about that one? Good. And can you slide this one way out to the side? Okay, and over that way. Okay, and do that with this other one. Okay, and this way. Okay, good. All right. And push up against my hand. Push up against my hand. Pull out. Okay, pull in. Oh, good. All right, now, let's see you move your knee. Just straight up, down. Okay, push. Okay. Straight up for me. Okay, push, push. Okay, good. Push, push. Okay, push, push. Okay, good. Now let me see you move your ankles upwards and point them down. Okay. Make the bottoms of your feet go together and go the other way. Okay, excellent, excellent. You're doing good there. Was it one? Okay, let's just check it here. Okay, check here. Okay, and put your arm right there. Like that. Okay. And just let that one rest there. You're not real bouncy today, are you? Bite your teeth together. Okay. Okay. And, okay. Keep your hands to do that. Okay. All right, we'll try that again while you're sitting up. All right. Okay. All right. Good. Yeah, we're gonna try that one again while you're sitting up too. Okay. And let me just check your pulses. Check your pulses. Check your pulses. There. So far so good. And now let's try these again sitting up. Well, maybe. There you go. There. Alrighty, we'll try this again too. I guess any of them are very hyperactive. Okay, good. Alrighty. And I'm looking at the fronts of your legs because I want to make sure that you're good in terms of your skin. Now, if you stand up, and I want to look at the backs of your legs here because I want to make sure. Did you know that malignant melanoma can occur on the thigh in women more commonly? Okay, now, where's my rolly stool? Here we go. I'm going to want you, please, to put your feet together like you're going to dive into a swimming pool.
Okay.
And I'm going to hold on to your drape here. The first thing I'm just going to do is kind of look. Look here. Look here. Okay. Now, let your head drop forward and your hands drop forward and just go as far down from the base to as far forward as you can go. Okay. And now come up just one vertebrae at a time. Real slow. Head levels. That's good. That's good. That's good. Excellent. Okay. And bend back towards me. Okay. And stand up straight and lean to one side. Lean to the other side. Okay. And now twist from your waist and look towards me. And twist from your waist and look towards me. Good. Let me get you tied up again here. And, okay, walk over that way on your tippy toes. Okay, now come back this way and walk on your heels. Okay, good. All right, now walk back that way, heel to toe, as though you were walking the line. Okay, good. And can you walk backwards? Okay, good. And turn around for me here. And just close your eyes. Okay. And hold your arms out in front of you. That's excellent. Can you stand on one foot? How about the other foot? Good. Can you take the heel while you're standing on one foot and rub it up and down like that? And rub it up and down like that. Okay, good. Alrighty, well I think you're in very good shape here. Just have a seat and we'll go over any questions that you have. And anything at all?
No, I think I'm all set.
Okay, well I'll sign off on that paper for you and we'll call it a day.
Thank you very much.
Okay, thanks. Thanks for coming in.
Yep.
Okay.